Hello and welcome to the Planetary Health Lecture Series. This module focuses on the intersections of community health and planetary health. I'm Dr. Shannon McMorrow, U.S. Fullbright Specialist, U.S.A. University, Faculty of Public Health. My home university is Western Michigan University in Michigan, U.S.A. The objectives for this lecture are to define community health, define planetary health, discuss the role of community health working with planetary health, discuss the role of elderly health care and health management with planetary health, and learn some examples of community-based planetary health. So to start, we're looking at this definition and thinking about community health as an area of study and practice that engages and works with communities in a culturally appropriate manner to improve the health of a defined community. So community health is one branch of public health that can work on and work with specific communities. That could be a geographical boundary, such as a city or a village, or it could be a group of people, so working with a community of women, or working with a community of a particular ethnic or language group. Next, what is planetary health? So there are many definitions, and I offer these simple ones to keep in mind. One is the interdependent health of human civilization and the natural systems on which it depends. Planetary health recognizes that human health and the health of the planet are completely interconnected. So when we're working in community health to promote the health of communities, we also have a chance and an opportunity to educate and raise awareness about planetary health. It's something that's not new. It's an approach and philosophy that's been around for thousands of years from different spiritual leaders and indigenous communities. It is something that has been more popular in the past 10 years when the Lancet Commission on Planetary Health released a report to start advocating for planetary health as a focus within public health. Planetary health is something that is cross-cutting across many of the Sustainable Development Goals. So you can see here all 17 of the Sustainable Development Goals. And then here we have some of the Sustainable Development Goals that apply most closely with planetary health and also the work that we do in community health. So one of the main and primary things that we do when we work in community health is to promote good health and well-being of community members. We also want to promote behaviors and actions that focus on clean water and sanitation, sustainable cities and communities. So when we're working on community health, we're also focusing on sustainability. Responsible consumption and production. So as community health workers and community health, public health workers, we can educate more about responsible consumption. Climate action, educating and raising awareness about ways to reduce the harm to the climate and the planet. And then also partnerships. So when we're working in community health, we often work in partnership with many other partners. So we work with the doctors, we work with the other educators in the community and work together to promote community health. This picture helps us get a better idea of how climate change is affecting our communities. So at the top, you see it says vulnerability, And below that, there are the 3 areas of vulnerability: the vulnerability factors, exposure pathways, and then health system capacity and resilience. And then below that, we have the climate sensitive health risks. So when we're working in community health, we're really focusing on the one on the far left, the vulnerability factors, and looking at the people that we're working with in terms of demographic factors, geographic factors, biological factors and health status, socio-political conditions, and then also socioeconomic factors. And then the one below that has all of the different areas where we see different kinds of health conditions that are resulting from changes in climate and changes in planetary health. So we can see that there can be injuries, there can be heat-related stress, there can be respiratory illness from air pollution, there can be more waterborne diseases and different kinds of bacteria and viruses in the water. There can be more vector-borne diseases. The nutrition is affected, so climate change can be impacting the soil and having less nutrients in the soil. And then when we're trying to promote nutrition and healthy diets, there can be malnutrition. There's also impact on non-communicable diseases, so things like heart disease, diabetes. Those can be made worse with the impact of climate change, like air pollution and the impacts on heart disease. And then also mental and psychological health. So some of the different changes in weather patterns or heat can also lead to worse mental health and stress. So all of these areas are important to us when we're looking at community health. And they're also important when we're thinking about interdisciplinary work with other disciplines. This one also lets us see a bigger, more holistic view. So in the green, you can see many of the changes that humans are causing to the planet and causing to the earth. So changing in the surface temperature, having different kinds of losing forests and old forests, changing the water systems, having more acid in the ocean, changing weather patterns. Those are all related to human actions and human behaviors. So when you look at the picture, that's why you see the arrows going back and forth. So the dark blue area are the different things that humans do that are causing some of the problems listed in the green area. So we can be looking at some of the areas that we can improve and actions and interventions that we can take to improve energy and transportation systems, change attitudes and value systems so that humans take different behaviors that are less harmful to the earth, have different governance policies, and work on changing our food and agricultural systems so they're more sustainable for the planet, and then also are more healthy for individual people. So again, what you see on the inside are some of the health issues we talked about already that can be impacting communities and impacting humans. So having the food quality, air quality, water quality, stress, all of those different things can be more harmful when we are doing negative things to the environment and having negative planetary health. So one area we do in community health is community assessment. So we look at the community and talk with the community to find out what are their needs and what are the problems, and then also what are the strengths and what are some positive factors going on in the community. And this is important when we're working on planetary health. We want to work directly with the community and talk with them and understand what they know, and also understand what areas they want to know more about and can benefit from learning more about. So what you see there are some of the possible needs. When we're talking with them, they may talk about challenges with food, challenges with air pollution, challenges with water. It could be water scarcity, not getting enough water in their community, or it could be water pollution and unsafe water that's making people sick. Also extreme weather events. And then there's also the possible strengths that are related to planetary health, that people may talk about having a positive experience from nature and spending time in nature. And they may also have some areas of strength with food and with water. When we're doing community assessment, there are many different ways. So it is ideal, it could be the best to talk directly with people, to go to the community and talk to people in person. So what you see listed are several possibilities: doing interviews with people, doing focus groups with people, something called photo voice that I can recommend, where you have people take photos of their life in their community, and then they discuss the photos to share more information with you. Also a community forum or a community discussion where people talk together. Sometimes if people aren't able to go out to the community, can also do methods like texting, using line or emailing and asking people questions to gather information from them. But it's an important part of planetary health and community health, and making sure we understand what does the community know and what do they need.